So looking at some clinical data, this is one of the older studies. It's about a little over 10 years old, but just kind of looking at kind of reperfusion versus recanalization. Sometimes it's kind of pretty important to kind of get an understanding between these two different these kind of two different terms. Essentially, kind of reperfusion is when you have kind of a filling of the AVM through different collaterals, whereas recanalization is kind of you kind of have a coil pack that's kind of incomplete in its packing, which and you're getting rebleeding through that initial area. Excuse me. Some of the previous studies have looked at kind of reperfusion of PAVMs after embolization, and the study by Millick did cite that it could be as high as almost 15% recanalization, looking at 112 patients. And unfortunately, we do see this from time to time, and it is important about making sure, one, you don't oversize your coil pack, but two, you're getting a nice dense coil pack to make sure that you're not going to see any recanalization. So the next thing I would like to talk about is one of the more recent studies, the Shimada study that actually looked at the use of your hydrogel coated coils for embolization. It was a retrospective single center study. And what they did was they looked at 57 PAVMs using the Azure Coil platform, and they tracked the patients between 47 months, mean of 19 months. What's interesting here is that their success rate was quite high at 98%. But one of the many things I love about my PAVM patients and my PAVM patient population is that because we're actually getting follow-up imaging on these patients, and it's a rather healthy patient population, it's one of the select few patient populations that you can actually go back and actually get a real good look as to how the coil pack is doing and how the embolization went. And that's why I personally think it's a great patient population to track in a whole host of different ways. But certainly, when you want to kind of get some, when you want to look at some of the more technical factors around embolization. So, with regard to this study, the median size of the feeding artery was a little over 3 millimeters, 3.7 millimeters, and with a decent venous sac size of about 9.3 millimeters. There were no reported cases of reperfusion or recanalization. That was pretty impressive, and it's something that kind of looking at some of the images from the study there, and I would encourage everybody to just go to PubMed and take a look. You could the images that were provided, they do show like nice tight coil packs, and they've been able to kind of successfully show that they don't recanalize. What's a very interesting. There are a couple of interesting pieces I personally feel around the study. The first is the use of that hydrogel coating. I personally feel that that hydrogel coating can be very helpful in embolization. There's a component of endothelialization that I think is promoted with the use of the hydrogel. So I tend to use these coils from time to time to kind of help to kind of promote those that factor, and it also makes for a nice dense coil pack. The overall volume of the coil is quite high, but you're still able to get a nice tight coil pack through that. And that's I think something to consider, especially when you start to look at coil compaction. The coils will compact regardless, but if you can actually get tissue growth into that area, I think the potential for reperfusion actually goes down pretty significantly. And then the idea that you actually have a coil that's going to be very reliably detachable, I think, is always important as well. The other part, is the fact that you can actually use fewer, I feel use fewer coils, using this coil platform to potentially kind of achieve the your endpoint that you're looking for. At the clinic, we are fortunate in that we have all sorts of different coils, and many times if we do have a single feeder, I think that it's great to use some of the plug technologies as well. I think that that could be very, very helpful, especially because they're reliably detachable, and you're able to, at a minimum, obtain a nice backstop for the rest of your coil pack. But if you do have a nice straight vessel, you are able to effectively deploy a plug, and ideally, the use of a single plug could effectively embolize the sac. Now, getting back to the Shimada study, some of their images we kind of have placed right here in front of you, but kind of just shows kind of some of the angiography, which you can kind of see. It's a rather simple AVM with one particular feeder. They embolized both within the sac and then the feeding artery kind of going back. And when they followed the patient up via MRA 28 months later, you don't see any recanalization in that. It was a really nice kind of dense coil pack right there. Some of the hydrogel literature, especially it's pretty well documented in the neuro space. This is essentially kind of a study that just kind of shows the kind of the hydrogel occlusion and the endothelialization that kind of occurs there. If you believe in kind of coil compaction and the phenomenon of coil compaction, I think that kind of the use of the hydrogel and kind of using the gel to kind of encourage that greater degree of endothelialization kind of has to be something that is kind of the next step where you kind of have to take that intellectual jump. Clearly, like in this study, you can kind of see that as they kind of opened up the aneurysm that was surgically made, you can actually see the kind of the promotion of the tissue formation within that aneurysm. And this just kind of shows a little bit of that difference again. As I mentioned, I feel that the kind of compaction is a real phenomenon, and kind of having that hydrogel to kind of promote a little bit more tissue growth is always kind of helpful. I mean, I think that we all know that it's there and it happens. It's just a matter of, is it going to happen? Is it going to work for us, or is it going to work against us? And I think that this platform could be helpful in that capacity. And this is just the second study I just wanted to kind of mention. It's the use of second generation hydrogel coil for the endovascular treatment of intracranial aneurysms. And essentially what they did was they looked at 484 patients, for treatment of intracranial aneurysms over several centers in France and Germany, using 243 hydrogel coils, 241 bare platinum coils, and essentially kind of looking at all comers, there was a statistically significant reduction in proportion of unfavorable primary outcomes in the hydrogel coil population, which was something that should go noticed. I thought it was a pretty well done study, all things considered. We can kind of I don't want to kind of bog everybody down with too much data here, but essentially I found that this slide to be quite helpful. I mean, essentially, when you're looking at kind of ruptured versus unruptured aneurysms, and then the aneurysm size, you can clearly see that within the hydrogel population, there was a significant difference, which kind of would favor the use of let's say a hydrogel coil to kind of promote the stability of that thrombosis within the aneurysm.